What would you do if someone around you had a seizure? Would you call 911? Would you try and hold or comfort them? Do you even know what you would do? This has been my life for the past 16 years. When I had my first seizure at the age of 2, doctors were unsure of what caused it and if it was ever going to happen again. It has happened again, and more than 40 times. As I got older, I began researching more about my condition. So what is a seizure? According to Merriam-Webster's dictionary, a seizure is an abnormal state in which you become unconscious and your body moves in an uncontrolled and violent way. Not every seizure is an epileptic seizure, though. According to the Epilepsy Society, the difference between an epileptic and non-epileptic seizure is simply the cause of the seizure. Epileptic seizures are caused by an abnormal electrical discharge in the brain, whereas non-epileptic seizures are provoked by bodily functions such as low blood sugar or a high body temperature. Even though these types of seizures are caused by different things, they can look exactly the same. Seizures are first categorized into two very broad categories: generalized and partial. Generalized seizures are caused by electrical impulses from throughout the entire brain, and partial seizures are caused by electrical impulses in a relatively small part of your brain. And there are 6 types of generalized seizures, but the most common and dramatic of the 6, which are also the kind that I have been living with, are called grand mal seizures. In this type of seizure, the patient loses consciousness and usually collapses. This loss of consciousness is followed by body stiffening for 30 seconds to a minute, and then by violent jerking for another 30 seconds to another minute, and after that, the patient goes into a very deep sleep for up to 24 hours. During grand mal seizures, injuries and accidents may occur, such as tongue biting and or wetting the bed. Another type of generalized seizure is called an absence seizure. Absence seizures are most commonly found in young children between the ages of 2 to 6. And absence seizures cause a short loss of consciousness with few or no symptoms at all. The patient, most often a young child, typically interrupts an activity and just stares blankly. These seizures begin and end abruptly and may occur several times a day. Partial seizures are divided into simple, complex, and those that evolve into generalized seizures. The difference between simple and partial seizures and complex partial seizures is that during a simple partial seizure, the patient is aware of their surroundings and retains consciousness. But during a complex partial seizure, the patient loses consciousness. Simple partial seizures are further subdivided into 4 categories according to the nature of their symptoms: motor, autonomic, sensory, or psychological. Motor symptoms include movements such as jerking and stiffening. Sensory symptoms caused by seizures involve unusual sensations affecting any of the 5 senses. Complex partial seizures, by definition from WebMD, include impairment of awareness. Patients seem to be out of touch, or out of it, or staring into space during their seizures. There may also be some complex symptoms called automatisms. Automatisms consist of involuntary but coordinated movements that tend to be purposeless and repetitive. Common automatisms include lip smacking, chewing, fidgeting, and walking back and forth. Seizures can be mild to severe, and they affect people differently. Although you may feel helpless around someone who is having a seizure and may find it difficult to watch, there are many things that you can do to help. You should prevent the person from injury and keep him or her from falling if you can. You should protect the person from injury. You should also try to move furniture or other objects that may injure the person from having their seizure. If the person is having a seizure and is on the ground when you arrive, try to position the person on his or her side so that fluid can leak out of their mouth instead of choking on it. But be careful not to apply too much pressure onto their body, because that can cause injuries such as a dislocated shoulder. How can you help after a seizure? Well, you should check the person for injuries. Also, if you are unable to turn this person onto their side during their seizure, do so when the seizure ends and the person's body is more relaxed. If the person is having trouble breathing, use your finger to gently clear his or her mouth of any vomit or saliva. You should loosen any tight clothing around a person's neck or waist and should provide a safe area where the person can rest. Do not offer anything to eat or drink until the person is fully awake and alert. This can prevent any sort of choking or anything blocking their airways. Make sure to stay with the person until he or she is awake and familiar with their surroundings and know exactly where they are, what time is it, and what day it is. Most people will be sleepy and confused after a seizure. Epilepsy is a complex disorder with many types of seizures. We have discussed what a seizure is, what epilepsy is, the different types of seizures there are, and what to do if someone around you is having a seizure. I hope that you never have to witness somebody who is having a seizure, but if you do, I know that you will know what to do.